Welcome, everyone. My name is Jim DeWald, and I'm the Dean of the Haskayne School of Business at the University of Calgary. Thank you so much for joining us today. As we broadcast from Calgary, I'd like to take this opportunity to acknowledge the traditional territories of the Blackfoot and the people of the Treaty 7 region in southern Alberta. This includes the Siksika, the Piikani, the Kainai, the Tsuut'ina, and the Stoney Nakoda First Nations. The City of Calgary is also home to Métis Nation of Alberta, Region 3. Please join us by acknowledging the traditional territories of Indigenous peoples in your location. We are all treaty people. Well, my friends, it's been a full year since COVID-19 pandemic changed our world. And it's been difficult, it's been challenging. And for many who have lost loved ones or been separated from their friends and family, it's been highly emotional. My heart goes out to you. But today's event brings more hope for a better day. Hope that as a business community, we can work together, move forward, and safely reopen our economy. Now, in conjunction with masks and distancing, we need to be mindful of the benefits of rapid screening. You might ask, what is that? Well, today you will learn about this important tool from the experts and from business operators directly engaged in administering rapid screening protocols, the people who have actually made it happen. We are doing this in conjunction with our important partners, the Business Council of Alberta and 19-0. I'm so proud to be a part of the coalition called 19-0, which is led by Dr. Jia Hu, family physician and medical officer of the Health for Alberta Health Services. Now, this coalition seeks to build trust, change behavior, and save lives. So today, we'll hear from an incredible lineup of innovators, health officials, and business leaders. But first, let me pass on some housekeeping notes. This event includes a panel discussion with Q&A. Please ask your questions by using the chat function, which is typically on the right-hand side of your screen. And not only that, but we've instituted a upvote method so that you can vote up the questions that you would most like to see answered. And with that, I would like to introduce the President and CEO of the Business Council of Alberta, Adam Legge, a good friend of our school and of the city. Adam, over to you.
Thanks, Jim, and welcome everybody. Really pleased to be part of this presentation and session today. And so we'll get the details on the video from Dr. Hinshaw and from Creative Destruction Lab very shortly. But in the interim, we're going to move to our question and answer and moderated session for today. And it's my pleasure to be the moderator for the panel today. And I'm going to introduce our panelists. First, we're joined by Sylvie Tran, Vice President of Environment, Health and Safety at Suncor, and also by Catherine Lilo, Air Canada's Senior Vice President and Chief Information Officer. And thanks for joining us all the way from Montreal, Catherine. So Catherine and Sylvie and their companies are both active participants in the Creative Destruction Lab Consortium screening project. So they're going to be able to tell us quite a bit more about what that program is all about, how it's been functioning in their companies, and we'd very much encourage you to ask questions to get an on-the-ground perspective of what that is like for potential new companies to be deploying these tactics. Finally, we're joined by Bart Johnson, who is Deputy Incident Commander, Alberta Health Emergency Operations. And so, Bart, I know you're a very busy person these days, so thanks very much for joining us out of your busy schedule. So let's jump right in. And as Jim mentioned, please do use the Q&A function and the upvoting so we can get to some engaging Q&A with our audience in a little bit. But we've got some questions we're going to run through that will give you a bit of a sense of what the program is like. And we're going to start with you, Sylvie. Now, Suncor introduced a rapid screening at the base plant in Fort McMurray and in the First Nation and Métis communities of Fort McKay. And I wonder if you could give us a sense of what the experience has been like so far. What are some of the basics in terms of when you started the program, why, and who's participating, how it rolled out?
Thanks, Adam, and thank you for inviting me to be part of this panel discussion. I'm thrilled to be here to be able to share where we're at with our pilot program around this rapid screening. As you mentioned, an organization called the Creative Destruction Lab invited companies to come together to identify and source COVID screening technologies for their workplace. Our objective was to determine whether we could develop a new screening technology to determine infectiousness for COVID-19, even without symptoms, in a cost-effective manner in order to look at how we could add a layer of protection for our workplace. So there are 12 companies from Canada in this consortium from various different industries, and our workplaces are all a little bit different from each other. So it's been a great experience to collaborate with folks that and companies that we normally don't collaborate with, and really exchange ideas. And for me, the experience has been that we have many more similarities in our workplace than there are differences. So those discussions started about last spring and started more formally over the summer. So in terms of our specific screening pilots, we have some pilots running at our operation in Fort McMurray. We also have a pilot running at our Sarnia refinery in Ontario, as well as a Fort McKay community up in northern Alberta. Participation in these pilots is voluntary. As of today, we're deploying close to 300 screens per week. So it's about 150 people being screened twice a week per person across our different sites. We're looking to expand an additional pilot in Saskatchewan, which would add about 80 fly-in, fly-out workers. And we're also considering how to scale up to include additional sites and also our travel hubs.
Great, thanks, Sylvie. And Catherine, how has Air Canada been using the screen so far? Again, how did you start, why, and who in the company have you got participating in it?
Yeah, thanks very much, Adam, and hello, bonjour from Montreal. As Adam said, I'm joining you from Quebec today, but have spent all, if not most of my life in Alberta, so just relocated to Quebec a number of years ago. So my family still resides in Calgary, and I'm incredibly pleased to have been asked to join you today because Alberta's got a very, very special place in my heart. Sylvie's really outlined the program in terms of what we've done beautifully. So I'll maybe just talk a little bit about the Air Canada context. We've got 9 locations. We don't consider ourselves to be piloting any longer. We are looking to scale this across all of our employee groups. We're using it in groups that are required to come to the office. So we are following public health guidelines, and our non-essential team members are working from home. But those that required to keep the airline moving, and that's an essential service for our country. Cargo has been a big part of what we've spent time on in the last year, moving essential workers. This is where we're focusing our screening, and the feedback from our team has been outstanding. We've had about 1,800 of our team members that have volunteered for screening. We're running about the same number that Sylvie talked about. One of the things I think you may find interesting is because this is hitting a population that is not being tested or screened in any other mechanism, it's looking at asymptomatic, so those that don't have symptoms of COVID, but are in fact carrying it. We have been able to identify in our workplace through this additional safety protocol that we're doing with the antigen screening, a number of individuals that have screened positive for COVID, and we have a 1-to-1 ratio when they go to get their confirmatory PCR test that they are in fact COVID positive. So what this means for us is safer workplaces, safer homes, and safer communities. And that's really what's been driving Air Canada to sort of lead across the country, along with companies like Suncor, but to also make it important for our own employees as an additional line of defense.
Thanks, Catherine. It's great to see, as one additional tool in our toolbox that we have to be continuing to live with COVID until we get more vaccinations rolled out, and the potential increasing realities that this will be more endemic than pandemic. These will be continued necessities as ways of operating business. Now, in our switch from the videos we had, the one person I'd like to bring into the conversation is Dr. Jia Hu, who is Alberta Health Services Medical Officer for Health and chair of the 19 to 0 initiative, and really doing a lot of overseeing of many of the technologies and protocols that Alberta Health Services is deploying. And we're going to get his take on what the actual screening test is all about. So Dr. Hu, I wonder if you could talk to us about the rapid screens. What are they, how they work, their features, potential limitations, and what people can expect with these actual devices themselves. So over to you. Thanks for joining us.
Yeah, definitely. And thanks everybody for taking the time to come listen to us. I think that, we all know that testing is quite critical to our ability to control COVID, right? If you know who's positive as quickly as possible, you can send them home and do the fast contact tracing. So what we have available, basically what happened is the federal government purchased a large number of rapid antigen tests and distributed them to all the provinces. And, in Alberta, we got 2 very similar rapid antigen tests available. A rapid antigen test is, well, 1, it's rapid, as in it can be done in 15 minutes. And 2, it's an antigen test. So it looks for a certain part of the virus itself and not the viral DNA, which is what the PCR test looks for. So what does that mean? Right now, the best test, what we call the gold standard, remains that sort of PCR swab you get done at the assessment center, mostly at the assessment center. But with these rapid antigen tests, we have millions of them, actually. It enables essentially sort of testing on site, whether that site is a workplace, primarily this audience, or, at an outbreak site or at other sites. Now, these tests are, when we look at a test, we look for sort of 2 main parameters, one of which is just if somebody is positive, how likely that test is to show they're positive. We call that the sensitivity of a test. And the other parameter is the specificity. If somebody is negative, will the test be negative? These rapid antigen tests for people who are symptomatic actually perform quite well in terms of detecting true positives. And for people who are asymptomatic, they don't quite fare as well, but they're meant to be used in a slightly different way than the gold standard PCR tests, as in you can increase the test performance if you just do them enough. For all these tests, they are quite specific, so you won't be seeing too many false positives, which is never a good thing because then you're sending your employees home even if they don't have to go home. And right now we are primarily, using nasal swabs for sort of this distribution purpose. And so, you don't jam something up your 7 swabs, throat, NP. It can be pretty annoying, but the nasal swabs are gentler. And so, we can get more into the sort of details of this if people have questions, but ultimately, I think the rapid tests really enable for essentially quicker epi intelligence for your employees, for your workers, that'll make your workplaces safer and actually enable reopening. And I know there's been a lot of excitement about them, and I'm pretty excited that you're all here and we can get them out as quick as possible.
Thanks, Jia. I think it's important to stress that difference between a screen and a test, right? This is something that is not necessarily the alternative to the swab to the brain test, and this is sort of funnels you into another potential line for some further evaluation and testing to really get to the core of it. And I wonder, one thing that I've encountered as people have been asking us about the program to direct people ultimately to BART, maybe if you just clarify, this is not something that is an individually applied screen. This is not something you can sort of send each of your employees home with 10 of them and you go do it on your own sort of thing. It's pretty specific. So either Jia or Bart, maybe give some people some clarity in terms of what this actually entails in terms of the deployment of it in an organization.
I'll defer to Jia as the scientific expert on this, and happy to fill in anything he's got to say.
All right. I think right now, like the initial conceptualization of the program is for people to sort of do it at work. Doesn't have to be a healthcare worker. They're pretty easy tests. Even I could use them. I'm pretty dumb. I think there are further permutations where they could potentially be done at home, right? I think the main thing is that like people have the training to do them effectively. And I was going to defer to you, Bart, because we were talking about is at-home testing available. I think it's being discussed right now.
Yeah, so I think first of all, Jaw's right. I think in terms of what we're exploring, we're taking steps, and I think probably the most prudent step is to have it done at work. Certainly, I see a day where people will be able probably to buy these things over the counter and test themselves. But as far as employee screening programs, it's something we'll explore soon. But I think in the early term, we're going to want to, I think employers are going to want to probably have a little more supervision, if you will, over how the testing program on their sites is working. But I think it's a direction we will be going, I think, ultimately.
Yeah, and just to layer on that, I mean, I think, groups like Air Canada, well, Air Canada's done a lot of these, right? And so I do think it certainly takes a bit of time for your organization to learn about these tests, introduce and apply some procedures and training. And by the time that's done, I suspect we'll be much closer to having those home tests. In Ontario, like somebody dropped a message in the chat box in Ontario, and I, texted my ministry friend just now. But in that announcement, some of the things they're doing, we already do in Alberta. For example, rapid test and long-term cares. But Ontario is doing some of the at-home testing now. And I think we'll get there soon enough, and read a lot of them. So the key thing really is for you to get familiar with the sort of supervised testing initially, and then we'll go to the still need to be supervised, but that's the first step.
Yeah, and Adam, if I could, I think it's been really well covered here, but the experience that we had at Air Canada, and I think this is probably similar to Suncor, is that at the beginning, kind of going from having no screening to your first site was a lot of work and took extra effort to kind of teach people how to observe. And we do observe self-collection. So we have our employees collecting their own samples, but they're being observed while they're doing it. What we are hearing from our team is that after I've done this 2 or 3 times, it's not that hard. And I probably don't need somebody to watch me do a little, 5 times on one nose and 5 times on the other side of my nose. It's really about the results collection and how you make sure there's some integrity in that process, and that you're following, if you do have a positive screen, that public health path that you would send somebody through. So, I think the way that this is being thought about in Alberta certainly is consistent with how we've experienced it. And we did a pop-up in Edmonton Airport, actually supported by Alberta Health, because we had a geographical issue that we were dealing with. And it was very easy to start up because we'd done screening in other locations, and then very easy to stand back down. So, that would be just maybe some additional context around what the gentlemen have shared.
That's great, Catherine. Thanks for that additional context. And Bart, just turning to you in terms of if organizations are interested in getting some of these screening devices, what's the process in terms of being able to access them through Alberta, Government of Alberta?
Well, thanks for the question, Adam. I think the short answer is we're still working on it and making up some of it as we go. But I want to take a step back and just pick up on what you mentioned earlier about and Jaw about the number of tests Alberta has. We do have a large inventory of tests. When we first received them, the initial focus was to use them to as part of the public testing program, to use them so-called on license in symptomatic people. AHS used them that way. And use them to help improve turnaround times, particularly in rural and remote areas and those sorts of things. Use them for outbreaks at long-term care facilities and others. And then, while that's the on-license use, there is this off-license use, I guess, to put it colloquially, which is what we're talking about here. It's not a diagnostic test, but it's potentially a really good screening tool. And that's so we turned our mind to that a few months ago, with a priority again focusing first on long-term care and designated supportive living facilities, and we've rolled those out now. Over the past month, we've got a few 100,000 of those of the tests on those sites, and programs are being carried out. And then during that same time, we also worked with a small number of companies, including the companies supported by Creative Destruction Labs, Also worked with a couple of companies that Adam, thanks, kicked our way, who are interested. And we're learning from that experience. We've supported some of those companies and provided tests to them. And through that, based on what we've learned through that collaboration, is we're looking at how we can support other employers and service providers. And we're just essentially putting the finishing touches on that. And we expect to be able to talk about that more publicly within the next week or so.
Great. Thanks, Bart. So folks, stay tuned. There'll be more announcements from the province on how to be getting access to those tests. So Sylvie and Catherine, going to switch over to the discussion on the CDL playbook. Now, that's something that part of your consortium you're working on. It's a bit of a guide in terms of how to deploy these within your organizations. It's not quite done yet, we know. And folks on this webinar will be getting information from the Haskayne School on when that is already. But maybe Sylvie, can you talk to us a little bit about generally what is in this playbook? How have your experiences gone into shaping it, and what can companies expect when they're beginning to look at deploying a program like you have at Suncor?
Thanks, Adam. So the playbook that we've been developing is exactly that, a playbook. So it really outlines everything that you need to know to deploy a successful rapid screening program. So it goes into roles and responsibilities. How do you do the scheduling? What are the potential risks that you should be thinking about? How are different ways you can lay out a screening station? What are the different regulatory requirements depending on which jurisdiction you're in? How to conduct a test? So really, it's all the things that we've had to think through as a consortium in order to deploy the pilots, and it also includes the learnings that we've had as part of the pilot. So it's been a living document as we've been implementing, sharing best practices, sharing learnings. That worked well, that didn't work so well. And so it's really a collation of all the thinking that we've done in terms of how to set this up in an efficient and cost-effective manner. So where we're at, the playbook is being made available for any provincial or territorial health authority to support companies, large, small, any industry who wish to set up their own screening programs. And we feel like the faster we can implement a system that allows businesses to open up and stay safely open and keep their workplaces and workers safe, the better. So the part that we've also been working on is simplifying the playbook. So it became quite an extensive document, and now we're also working to simplify the playbook so that it's more digestible. Yeah. Catherine, did you want to add anything on your side?
As usual, Sylvie always gets all the right answers, so it doesn't leave me a lot to say, but if I could, I might add a couple of complementary thoughts. Sylvie at the front end of this talked about CDL, and I'm not sure if we'll bring the video up at some point, but in case we don't get it up, the one thing that was binding to all the companies that joined together in CDL was this was for social good. This was not about doing something that we were going to sell or create a product around. This is about reopening the Canadian economy in a safe and productive way. And a group of like-minded companies, and where else would you get a Suncor, a Magna, a Genpack, a Loblaws, a Rogers, and Air Canada executives all working together, putting resources on something with no thought to anything other than doing the right thing for the country. And as Bart said, there's millions, tens of millions of these tests sitting in warehouses that we have an opportunity now to activate on. So the thing I would sort of add to Sylvie's comments around is the getting the screens is the part that's probably easiest. The making sure you set up a system within your organization to use these screens and track things properly and make it easy for your employees to actually participate in the programs. That's the little trickier part. And the playbook that Sylvie talked about is really your blueprint to do that. And each of the organizations have adapted it for their own reality. But from an Air Canada perspective, the thing that we think about from a customer perspective is trying to make our customers' lives easy. We've done exactly the same thing with the screening program, including putting together a system where they can register online, they get their results online. It's part of their normal process of how they do their work. And I know that's very consistent with how Suncor's done it. The thing that I find extraordinary about this is that all of the companies in the consortium are giving of their time and their expertise. So any one of the consortium members, if there's companies that are interested in embarking on this, I think, critical layer of defense in restarting the economy, you'll find very willing guides to help you establish that screening system, in addition to the guidance and support that health services is going to, that sort of practical on the ground. We learned that lesson the hard way, maybe don't do it like that. That's been the really fantastic thing. And as Sylvie said, this is a work in progress from a Playbook perspective.
Yeah, thank you both for that. It's we're excited to see the product as it rolls out based on the experiences you've all contributed to it. Bart, in terms of have you had any views and your initial assessments of the playbook from Alberta Health Services standpoint?
Yeah, we received a copy of it within the last few days. Got a chance to read through it with a couple of colleagues yesterday. And find it's an excellent resource for companies that want to bring rapid screening programs to their workplace. It provides clear, very detailed explanations about the use and the benefits of these programs, some clear advice, and again, really detailed advice and instructions, including recommendations, consideration on how to set up your site, how to administer the tests, how to manage the waste, how to communicate results to employees, which is really important. All of it's really important, and it all comes from experience. It wasn't something that was just put together because this logistically sounds like the right thing to do. They've tested it. The consortium essentially has experimented with it. So I see it as a really useful tool for companies. As I mentioned, we've dealt with a handful of companies. Some of them are part of the consortium and some of them aren't. And those that aren't, they want to know, well, how do I do this? And so we're providing, some suggestions, if you will, some advice. But this provides us, I think, a resource that we can point people to and say, here, have a look through this, see what you can find useful there. Again, really detailed, really useful information. There's also a really important section in it on regulatory requirements, and that's really important to us, including the public health guidance, the rules. We can be quite flexible, I think, with this program and with the use of the tests. As Ja said, they're nasal swabs, so you don't need to have a healthcare provider. There's fairly minimal requirements, but there are some. And some of those have to do with how you have to treat positives, how you need to communicate to negatives, all those sorts of things, and that's spelled out in this resource as well. So I think once it's made public and available to businesses, I think they'll find it quite helpful. Even if they haven't decided to already set up a program themselves, they could, there's a good section in here on sort of the rationale and the benefits for running a program like this. And even that alone is worth having a look at to see if it's the right thing for your business.
Bart, that's actually a perfect segue to wanting to explore with Catherine and Sylvie, what are the benefits, what are the impacts, what are the outcomes on the business operations side of things? It's obviously in a pilot, a very early stage. You're not going to get the full suite of benefits because there's a lot of learnings and tweakings along the way, but ultimately you want to get to a place where this is providing a benefit to the business and to the health and safety of employees and customers. So Catherine, I'll give you the first word on this one. What have you seen with respect to the implementation of this program in terms of COVID rates, transmissions, business operations, from essentially a pre-basis and now a post-basis with implementation of that? So Catherine, over to you first.
Yeah, Adam, thank you. And again, we're still fairly early days. Both Suncor and Air Canada started their screening programs back in January. So we're not talking, we've been doing this for many, many months. So the data set is still small. I think the other thing is that we are still very mindful, and Bart, you rightly pointed out, like public health guidelines trump. So we have not used screening as a mechanism to change anything that we're doing in our workplace because all the public health guidelines across different provinces and jurisdictions are driving our behavior there. And Suncor, I imagine, would be exactly the same. A couple of things I would note, though, is that we've started exactly that conversation. So I'll give you an example. Right now, we've got 2 system operations center where we used to just have 1. And we did that at the beginning of the pandemic to basically create 2 bubbles for an operationally critical part of our organization. And we've now deployed screening as well as wearable contact tracing in both of those environments. And as we sort of begin to roll through vaccinations and, easing of public health restrictions, we all hope, based on positive case counts, those are the types of things we're starting to say, can we go back from 2 sites to 1 site, which would have some efficiencies. I really think the biggest benefit that we have had, though, is Canadians are tired and our employees are tired, and our industry has been particularly impacted by COVID in terms of going from, best year we've ever had in 2019 to laying off 20,000 Canadians in the last 12 months. And I think activating our employees to do something productive that's helping has been really, really positive for our own organizational mental health, if I could say it that way. And the feedback that we're getting from our employees, as well as our labor groups, who have been incredibly supportive, our unions have been very supportive of us doing this with our employees, is it's great to see that we're adding another layer of protection to have our employees be safe while they're providing essential services as that's becoming available. So, I think we're just starting down the operational effectiveness journey, guided by public health guidelines. I think the real benefit has been our team feeling like they're activating and doing something to help, not just with our company, but with the health of the community. So, Sylvia, I'll pass it to you to add comments from a Suncor perspective.
Thanks. I think Ja had his hand up. Maybe I'll hand it to you, Ja, and I can provide additional comments.
Yeah, no, I mean, I was going to say this, but Catherine really nailed it, right? Like, I think when it comes to COVID, like, one, it's very clear that it requires like an all society response. So in Christmas in Alberta, nobody could see their family, and that really sucks. And in the next few months, we're going to ask everybody to get a vaccine. And, I've worked with many of you, actually, different companies. And I think that there is often a sense, it makes sense, what I call loss of agency, right? Like, what do I do? I'm at the whims of public health. If I get like Ja mad, like you'll like fine me or something. But the reality is that we need companies on board. We need everybody on board, right? And I think that these tests are one very good way of like restoring agency to, like to let you contribute, along the way you actually can make your employees safer, which is also really important. And, the same will apply to vaccine. But I think that I am really, not only will these tests give you that epi intelligence that people like me want, like it's just it's a way of fighting back, right? And we've been at the whims of COVID for much of the last year, and now we can fight back. And I think that's really, really lovely. So sorry, that's all.
Thanks, Joe. That was great. For us, I think I would echo Catherine and Joe's comments about the impact that this is having on our organization. We are very early days in terms of where we're at in our pilots and how we're thinking about scaling to more sites and more employees and contractors. I will say, I guess, a couple comments. One, it is, all about doing our part to reopen the Canadian economy, including our and having our employees be part of it. We really are committed to doing our part to figure out how to deploy this effectively and cost effectively. In terms of data pre-post, we really view it as screening as an extra layer of protection in addition to mask wearing, washing your hands, social distancing. So really not focused on data collection pre-post. For us, it's more of an additional layer that can help protect our workplace. And so that's really how we're viewing sort of the data collection piece of your question. And then finally, we've only had 3 positive screens. From a results perspective, 2 of them actually ended up being negative PCR tests. So that's what we do. We have, if someone screens positive, then we direct them to get a PCR test. So out of the 3 positive screens, we've had 2 that were false and 1 that was positive. And when you talk to the employee who ended up being positive, the relief and the appreciation for being part of the pilot and being able to identify that they were positive and asymptomatic was really great to see. That we were able to break that one transmission, and the employee was very grateful to know. And so they're at home isolating as we speak. So I do sense that our employee base, knowing and being part of the pilot and knowing that they screen negative doesn't mean that our other layers of protection are not important, and we need to continue, but they do feel like they're doing their part and feel like they're keeping themselves and their family with that extra safer with that extra layer.
Yeah. We're going to tackle one final topic, and then we're going to move to the videos, and then we're going to get to the audience Q&A. So Catherine and Sylvie, in terms of getting employee buy-in, Ja talked about agency and whatnot, but what were ways in which you used to get buy-in, to get support from your employee base? Obviously, Sylvie, your story there was that there's some great relief. And that's a positive story to be sharing in terms of getting more people on board with this. But did either of you make it mandatory, or how did you roll it out to gain the support of your staff? Catherine, we'll start with you.
Yeah, it was interesting. So as folks are looking at doing this in their organizations, I think our sort of first barrier was, why do we want to do it? There was no one else doing this in the country, and why do we want to do screening? So the probably the largest barrier that we had to get over was our own leaders within the organization and concerns around, well, how are employees going to respond to this? We're doing all these other things that are keeping them safe. And it was interesting to kind of see that from a change management perspective. The very cool thing is that they became our entire change management program. And so as we began to do our first pilot site, our second pilot site, we had sort of set a target of 25% of our team members volunteering for it. I think without exception, we're at 60% in all of our pilot sites now. It's a virtuous circle. Good begets good. And the biggest challenge we actually had once we got up and rolling, we spoke with our unions before we started the screening program. They were very supportive. Again, they viewed it as an additional layer of defense. Was that we had walk-ins. So we set up in our Toronto airport, and it was for our Toronto above the wing and below the wing. So when you go to check in an airport or your bags are getting loaded, we focused on that group. Again, a concentrated work group. What we were finding is our flight crews were coming in and going, hey, how do I get into this program? And then we have other airports phoning saying, how do we get part of this screening program? So for us, it was kind of a big push to get to one. Then after that, it became a demand pull. And now we're at a point where it's like, okay, now we're in full scale mode. And the great thing about the playbook, and we've tuned it for Canada's usage, we can stand something up in days. So those would be my comments. Sylvie, anything you'd like to add?
Yeah, I think for us, it's been similar. We've made a couple additional items that we've been doing. One is in terms of first getting senior leadership buy-in, support, visible leadership on this has been very important, and everybody has really stepped up within Suncor to promote and lead across the board. Secondly, really have a lot of communication to address employees' questions around, what is it not, how does it work? And so we developed a communication plan that included social media, that included emails, leadership engagement for them to engage with their own employees and their teams, as well as setting up live events with Dr. Tyler Mel and myself, where people can just join in and ask their questions and get answers directly from a medical professional. So that's been quite successful in terms of just having a multifaceted communication plan to address people's questions.
Yeah, and if I could just, the really, really encouraging part about the consortium is Sylvie would give her stuff to Air Canada. Air Canada would give their stuff to Rogers. Rogers would text on the weekend and say, what about this? And so I think we all really supported and encouraged each other as we were standing these pilots up. And like I said, you couldn't even envision an opportunity where across industry, large Canadian companies would collaborate in the way that, we've seen our companies collaborate. It's truly inspiring.
Thanks to you both. Bart, I'm not going to exclude you. We got lots of questions from the audience that I think are going to be heavily answered by you. So we're going to pause here, folks. We're going to introduce the videos that one from the Creative Destruction Lab on the initiative itself, and then hopefully that message from Dr. Dina Hinshaw. So we're going to pause here, folks, a couple minutes of some videos, and then we'll be back to tackle the audience Q&A. So over to Control Center.
So nice to be with all of you in Alberta. I'm Janice Stein, part of the CDL Rapid Screening Consortium, convened last spring by the Creative Destruction Lab at the Rotman School at the University of Toronto, along with 12 of our founding Canadian companies, to come together to work on rapid antigen screening for people who show no signs of COVID-19, who are asymptomatic. Why did we do this? Because we wanted to add an extra level of protection to make workplaces safer for those who work in them, and to help businesses reopen as quickly as possible. We've come a long way in a very short time. We are growing and expanding, and it is now becoming widely accepted that rapid antigen screening is going to be an important tool in our toolbox as we move through the next 18 months and begin to come back to work. We've been able to develop a playbook and a data system, and I'm going to turn to Sonia Senek, the Executive Director of the Rapid Screening Consortium, to tell you a little bit about those.
So thanks very much, Janice. I'm going to talk about two aspects of the CDL Rapid Screening Consortium. One is the playbook. So the playbook is our standard operating procedures manual. It's a compilation of recommended best practices for all aspects of pilot site operations. It's being developed by all of our consortium members and all of the companies that are running sites and learning every day that they run their rapid screening system at their workplace. How does it get used? Three ways. One, it provides a resource to train and onboard teams to run the rapid screening program at their workplace. Two, it's a vehicle to innovate. So as we run pilots and learn, we update the SOP playbook and reflect best practices. And lastly, as a foundation to scale. So as the pilot site term runs, if there's an opportunity or interest to scale those sites or to other sites, the playbook can be used as a resource to do so. Second is the CDL RSC data system. So we put together a structure with our consortium members. We did a lot of work on privacy, cybersecurity, and data sharing so that we could have de-identified data transferred from all of our consortium member sites to a central data dashboard. So it's de-identified with unique, we don't have names or dates of birth, it's de-identified data, but what it offers us is an opportunity for employers and provinces and provincial and federal public health authorities to take a look at the way in which, the screens are being used, how many negatives, positives, inconclusive, as well as, how many presumptive positive screens came back as a confirmed PCR positive as well. So it shows a distribution of that type of information, as well as operational data, screening turnaround time, how long does it take for someone to check in, what's the average, and companies can leverage the learning of the centralized data to make business decisions and help operate the rapid screening sites.
Thank you so much, Sonia, for that. We are at an exciting moment now as new companies are joining in cohorts. They're having a great time because they are being mentored by the first wave and sharing their hard-won experience. And each cohort is doubling and also taking on the challenge and the fun of mentoring new companies who come into the consortium. This is a great time to join as we scale up and continue to learn and to innovate together. Check out the website, the CDLRSC website, and if you have any questions, email Sonia, whom you just met. And thank you for your time.
Great, thanks. I'm not sure if we'll get to the Dr. Hinshaw video. Maybe we can move to that a little later, but let's jump into some of the questions that are coming up from the audience here. And I think many of them are sort of around some of the technicalities of the tests screens themselves. So Bart and Job, I'll sort of weigh in start with the two of you. First and foremost, Bart, people are asking about the cost of these tests. And so right now I know can you share us if there's the cost structure now, and then what you talked a little bit earlier about is something that maybe eventually you can go to your pharmacy and get for personal use. What would you see in terms of the cost per unit into the future?
Well, I think Adam, the only thing I can speak to are the tests that we have in our possession. To this point, when we've been providing them to the long-term care facilities, to other licensed facilities, to some of the employers we've been working with, it's been at no cost. They were procured by the federal government and shared with all of the provinces. And so we're happy to share them where it makes sense to employers and service providers. So there wouldn't be any cost to the test, but we are leaving it up to the service providers and the employers to resource the actual programs on their site. So if they're going to run a program, they're going to have to make sure they've got the logistics worked out, the people trained up to do it, those sorts of things. And that would be, all have to be at the cost of the employer. But as far as the tests go, we would provide them free of charge. And then Adam, my comment about someday being available over the counter. I mean, there are products like that already in some other countries where you can buy these home tests. And I think if or probably when they're approved for use in Canada, then those would be available. And I don't know what they would cost. The antigen tests tend to be less expensive, fairly affordable actually, compared to some of the other tests out there.
In terms of the frequency of testing, maybe I'll turn this to Sylvie and Catherine. Maybe what would be the appropriate protocol for the frequency of testing? And then Sylvie and Catherine, maybe if you can weigh in with what you're deploying in your companies.
Yeah, I mean, I believe that, within like the CDL recommends twice weekly testing. I think from my perspective, that's a pretty good frequency, to be honest. But, you can scale up and scale down. I'll give you some extreme examples, right? For the NHL bubble, daily testing with PCR, because the idea was to really just catch everything, different tests. For these screening tests, I think just the way these tests work, right? Like very fundamentally is like this. Like if I have a positive result, I know I'm positive, but if I'm negative, I could still have the disease and be incubating, right? And so there's like this world where if you could test everybody every day, you would like have immediate intelligence. However, you don't necessarily need to do that to get sort of a sufficient amount of granularity to keep employees safe. And so I actually quite liked it twice weekly. That's probably what I would have come up with, which makes me feel smart. But like, it can vary based on your employee population, I think, from a public health perspective. So yeah, go ahead.
Sylvie, what are you employing at Suncor?
Yes, we're doing our pilot at twice a week. So that's been the best practice, or the agree, what CDL consortium members have agreed that would be the frequency to start with. And I know there was a question about how long it takes. We're still in pilot phase, so I wouldn't say that the times that it takes us right now has quite some variability as we iron out sort of the kinks at the different sites. But the goal is to get somebody in and out in a few minutes, and from start to finish, from start coming in and then getting your result on your phone, in less than 18 minutes, 20 minutes type of time frame.
Yeah.
That's our goal, but we're not there yet.
Yeah, same in Air Canada. And I think compliance with twice a week is something that we're working on, because we're getting a lot of people that are coming in kind of irregularly to get screened. And to Jaw's point, we have some groups that are actually wanting to get screened more regularly. So we've got some areas that are every second day that they're choosing to do the screening. And we're about 90 seconds in terms of someone coming in, doing their screen themselves, being observed, and then kind of being out the door. So we've really become quite efficient in that process. And I think the last piece is that, to the degree that we can task shift the screening out of healthcare, the less burden we're going to put on healthcare as we really ramp up vaccination and making sure that we've got all the help in the hospitals that we need to deliver not just COVID care, but other care, which we recognize is becoming a bigger and bigger problem. People are avoiding their medicals and things like that. I couldn't say enough how important it is to have a screening program associated with a task shifting program, so that we don't put any more burden on the healthcare system. And we also drive costs down for organizations, but still get the intended results.
Yeah. Important to note that it's so important to have resources within the company, so that we're not pulling medical professionals out of the public health system to be deploying this. Sorry, Bart, looks like you unmuted. Did you have a?
Yeah, I was just going to add in terms of the frequency, what we've found in the research we've done and the modeling that we've read is once a week would be a sort of a minimum amount. Twice a week would be good as well, and understand that's where CDL has landed. I think more than that, we've had some employers recommend, ask about, oh, should we be doing this daily or something? I think after twice a week, there are diminishing returns in terms of the resources required to do it. And that seems to be sort of what the modeling shows. So once a week, twice a week is probably a bit better, but more frequently than that doesn't seem to make sense.
One question here, I think pretty easy to just quickly address, is a question is, where do we find the resources once it's public? So on the procuring the tests themselves from Government of Alberta, Bart said information on that will be forthcoming very shortly, so stay tuned to your public announcements on that. In terms of the actual CDL playbook on the program, after this webinar, there will be an email that will come out on where you can get that, where you can stay tuned for getting that once it's been made available, and all folks registered on this webinar will get that email in terms of how to access that playbook.
Adam, do you mind if I just jump in on this?
Yeah, please.
Yeah, so there's another resource that has to be considered. I know we've talked about task shifting and having non-healthcare providers performing the tests and the analysis. And certainly we're on side with that and supportive of that. But one of the, where we have landed in terms of running the programs, it will be a requirement that there's a healthcare provider overseeing the program, not necessarily specifically on site, could be virtual, whatever. And so that's another resource that companies are going to have to think about, is where would they procure that? Big, larger companies have some of that sort of expertise. Certain organizations already have built-in expertise like that. Others, we're going to be providing a list of potential resources for people to follow up on. I know a number of pharmacists might be interested in supporting this. We're aware of OHS type companies and other testing companies and that sort of thing that would be probably available to assist in that. So I just wanted to make sure that that's another resource that companies are considering, and we'll do our best to, I think, help identify those resources for people.
Yeah, thanks, Bart. A question here about the use of these devices and tools for large gatherings, and we could use it for everything from hockey games to concerts, even on a large airplane, Catherine. The question is that Minister Shandro mentioned that the test wouldn't be used as a tool for screening to large events due to not being completely reliable. But the question is for the panelists, do you see these tests as being a meaningful method or tool for large scale in-person gatherings or very close contact, longer period gatherings such as a long haul flight? Maybe I'll start. It looks like Bart's unmuted, so we'll go to you, Bart, and then maybe to you, Ja, and then Sylvie and Catherine, if any of you thoughts on that. So Bart, we'll start with you.
Okay, thanks, Adam. And sorry to jump in, but so at the risk of scooping Dina, if we do get to watch her video, but she'll talk about these tests as a red light test, not a green light test. The results, if you're positive, as was mentioned earlier, it is a fairly decent likelihood you are positive. And what it does is it puts up a red light and says, okay, we got to take you out of this situation. But it's not a green light. They're not reliable enough that if you get a negative, it's not uncommon at all for that negative to be wrong. And so it's important for people to understand that if they screen negative on one of these devices, it's not licensed for them or a green light for them to take their mask off, to get close to people, to start ignoring the public health requirements out there. And so that's sort of one of the reasons we're reluctant to suggest that this is something you could use to screen a hockey game or something with people coming in. Is you could stop some potential positives for sure, and that would be a positive. But it's important, you'd have to communicate to everybody that this doesn't mean that you don't have COVID, and you have to be careful about managing yourselves accordingly. And so it wouldn't at this point allow for large gatherings, because right now large gatherings aren't allowed. And using these screens to weed out some of the positives, they're not reliable enough, as the minister said, to be able to then drop all the other public health guidance. So that's where we're at now for sure.
Great, thanks, Bart. Ja, anything to add to that?
Yeah, no, for sure. And I totally agree with that. So there's some constants, right? So when we think about how much to open or close like society, that is driven by a whole constellation of factors, right? And so, again, right now, even people who are vaccinated have to continue following the current public health guidances. You might have seen in the US, the CDC is letting people who are vaccinated do a bit more, and I'm sure that'll come to Canada at some point. Now, when it comes to large events, I think that, again, the tests are like the way they optimize. You just agree with what Bart said, basically. I mean, I think there's also a logistical chat. Let's say we want to reopen the Saddle Dome, 20,000 people coming in. The tests do take 15 minutes to pop, right? And so you need a ton of these to make that feasible. There are other sort of, I'll say, contact tracing tech type things that we're contemplating to enable reopening. But I think the way in which these tests actually do enable macro reopening as opposed to specific reopening is that the better intelligence we have, the fewer cases we have, right? And by that, I mean, if we had a few months with 5 new cases a day, I'd assure you lots of stuff would be open. And so I wouldn't make a direct link between big events and tests, but I would make an indirect link between anything that improves our response, aka testing, with the rate at which we can reopen.
Great, thanks, Ja. Catherine and Sylvie, anything to add in terms of using these for large gatherings in your experience, or pretty much covered by Bart and Ja?
It's interesting. Maple Leaf Sports and Entertainment is part of the consortium, and we've had exactly this discussion. And I couldn't agree more with what the other two panelists shared. Is that I think there's a layers of things that need to go on as we look at reopening. And, you know, certainly I want to be able to hug my mom and dad first before I worry about going to a hockey game, like sort of step one for me. But as you think about, you know, mass reopening, it is that combination of vaccination level, of contact tracing, and us thinking about that a little bit differently, you know, QR codes, you know, being a little bit more specific about where people are going. And then I think it is, to Bart's earlier point, if we can start to make these more readily available for people to be using them at home, and there's comfort around that from the regulator, you know, all those things together start to ease us towards normalcy a little bit. But I think to Jai's point, you know, this is another mechanism for us to reduce the chain of infection. Like you said, it's the red light. And right now we don't even know some of these people are red lights. And I think this is a great way for us to catch those that don't show symptoms. And as Sylvie said earlier, our employees are incredibly grateful, because walking around and not knowing it, going home and not knowing it, their family perhaps being positive and not knowing it, all that helps with the chain of infection and takes burden off of our already incredibly overburdened healthcare workers. So those would be my only adds.
Yeah, thanks, Catherine. Bart, I'm going to blend a couple of the questions here. First one is who's training, once you deploy the test to the organizations, companies, who's training the representative within those companies to be able to administer those tests? That's part A. And part B is, does that person who oversees the testing protocols and implementation have to have any kind of credential or certification? Do they have to have any sort of medical background or healthcare professional? What's the structure that you're seeking from companies?
So to this point, the discussions have been focused around having that oversight being provided by a regulated health professional, and a subset of, there are about 30 regulated health professionals in the province. It'd be a subset of about 10 of those. And I think you can probably imagine a physician, RN, LPN, paramedic, pharmacist, you know, a number of others, a lab person. So that's the group that you'd have to draw from, and it would be that individual or individuals, depending on how large a program you've got. They'd be, among their responsibilities would be to train the people that they're going to use for collecting the samples and doing the testing, if they themselves won't be doing it. But the program will require a healthcare professional. That's certainly the direction we're going right now. And as I say, we'll have lots more detail on this in the next week or so.
Great, thanks, Bart. And what information requirements are you collecting or requiring from the participating companies in terms of the results and the positivity rates, and how is that recorded and reported? Is there any established means of that?
Yeah, you know, we're talking about that as well in terms of what's required of companies, and we would want some reporting. We'd like to know how the tests are being used, how many are being used, and how many of them are resulting in positives. We wouldn't want any personal information, you know, private information. It's not of interest specifically to us, and it just it would create you know, a lot of additional barriers and legal issues around that. And so we're not interested in any personal data. It would be aggregated high-level data, how many tests have you used, how many positives, that sort of thing. The sort of stuff that's already been shared by Sylvie and Catherine here.
Yeah, perfect. Great. Well, folks, we've hit the time where we have to, we're going to turn it to Dr. Hinshaw in a moment here, and then I'm going to turn it back to my friend Jim DeWald to bring us to a close. But please, on behalf of everyone watching, join me in thanking Catherine, Sylvie, Bart, and Ja for their insights, for their leadership in being a bit of a series of trailblazers on this program, and making sure that we can get Canada back open again as quickly as possible, and making sure that we can minimize and limit the spread of COVID-19, keeping our colleagues, our friends and family safe. So thanks all for sharing your experiences, for all your hard work that you're putting in these days, and really appreciate you spending some time with us today.
Thanks, Adam.
Thanks, and we'll now turn it over to Dr. Hinshaw.
Hello, I'm Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Thank you so much for the opportunity to speak today. I'm sorry I couldn't be there in virtual person, but I did want to record a short video to make sure that you know how much I appreciate the work that you are doing to consider how you can keep your communities safe. The consideration of using rapid testing is one tool among many as we face this pandemic and as we move into our second year. And hopefully this year will be very different from the last because we have many tools with which to fight the pandemic. Rapid testing is certainly one of them, but it's important to remember that we need to use the right tool for the right job. So I'm as guilty as anyone of using whatever tool happens to be at hand. If I need to hammer something, sometimes I grab a screwdriver and use the end of it, but it doesn't do the right job actually, and it sometimes causes some damage. So it's important when we're using a tool to know what it can do and what it can't do. Rapid testing is very helpful when you're using it in a population and doing frequent testing over time so that you're able to use it as a red light test and having people who test positive not coming into a workplace or into a community. But it doesn't work so well as a green light test, meaning that it's possible to test negative and then potentially be infectious within that same day because the test isn't quite as sensitive as some of the other tests that we have. So when you're considering how you could use it in your workplaces, it's important to remember how it works well and how it doesn't so that you can use it to improve safety and not put safety at risk. One of the other questions that we get a lot is as vaccines are more available and the population starts to have access to them, will we still need all of this testing once we have people with vaccines on board? And the answer is absolutely, and certainly in the short term, as there are still questions we have about vaccines. We don't yet know exactly how well the vaccines prevent people from getting a mild or asymptomatic illness and potentially being able to pass the virus on to others. So rapid and regular testing is actually going to be very helpful, especially with our extended interval from first dose to second dose of 4 months. We know that first dose provides a high level of protection, around 70 to 80%, but there's still that 20 to 30% where they might be able to be infected, and we need to make sure that we're continuing to monitor for that. So again, I want to thank you for the opportunity. Thank you for your work to protect our communities. And I wish you a good conversation today, learning about how this tool of rapid testing can be best applied.
Thank you, everyone. And thank you so much, Adam, for handing it back and for the great job of moderating the panel. I want to say I'm very grateful to the Business Council of Alberta and to 19-0 for partnering with us on this important event. Big shout out to CDL and initiating the whole Screening Consortium, which is really a very progressive move for Canada. Just so you know, CDL has 9 locations around the world. So it includes Oxford, Paris, Atlanta, Wisconsin, as well as Vancouver, Montreal, Halifax, Calgary, and Toronto. So that's great Canadian leadership. I want to thank Sylvie and Catherine so much because your comments, I think, really hit home with everyone. Sylvie's saying that your people are proud to do their part, which is so powerful. And your commentary on the positive asymptomatic finding and what that meant to the employee, I think that really moves us all. And Catherine, you're so right. Canadians are tired. Your employees are tired. And the ability for them to activate, to do something and be proactive, I think that's just so powerful. And it's something that I'm happy to pass on to everybody here as a message. You will receive an email that will give more information on what you can do for your company going forward, as well as when we have it set up, a link to this recorded webinar that you can share with others so the message gets out. Have a great day. Thank you all so much. Great event.